Imagine being a young person living in a nursing home. It's not easy. It breaks your spirit. I don't want to go back. I shouldn't have to.
And nobody wants you to. What do you think is the reason that you'd have to go back? What would send you back to the nursing home?
I wish that I could offer my caregivers more. I try to do my best to show them they are valued. But their job is hard and they deserve more. It's scary because if we can't figure this out, I will lose everything. I worked 15 years to get out the nursing home. Found this beautiful home. It's modified for me, and I don't want to lose it. I am trying to be hopeful. But the world is crazy and reliable workers are hard to find, and I worry every day that I won't be able to stay here. My heart will break if I lose all of this because lawmakers aren't protecting people like me. I am part of one of the largest minority groups in America. There are over 6 million adults with disabilities and many of us could live in the community if we had the right supports. It'd cost the taxpayers less to support us in homes instead of sticking us in long-term care facilities. Please help me spread awareness about this and help me stay in my home.
In the nursing homes, there are all types of people. It's not just older adults, there's young babies and teenagers that live in nursing homes and they want to get out and live in their own homes.
Happy ADA, happy 32nd anniversary of the Americans with Disabilities Act. CDR works from a space of disability justice where we center Black, Indigenous, people of color, BIPOC, disabled people. And we also have as our number one issue area to end the horrific institutions around the nation and the fact that disabled people are still inside institutions where they are dying and being harmed at a higher rate than most people in our own public systems. We are working for the bodily autonomy of disabled people.
Flip wanted to live on his own for many years. It was the Center for Disability Rights that helped him find a place of his own and allowed him to gain his independence. There are many more stories just like Flip's. Stay tuned for the next half hour to see how you can help CDR help others.
Welcome to our show tonight. Thank you for joining Center for Disability Rights and the Regional Center for Independent Living as we celebrate independent living and the 32nd anniversary of the Americans with Disabilities Act in the Rochester community.
Well, the higher philosophy is do whatever we can to keep them in the community. There's a lot of different services is needed. It's up to us to really, provide it for them and give them that level of support, especially when they don't know how to navigate through the system and they depend on us.
This is Assemblyman Damon Meeks, representing the 137th Assembly District. I am proud to join the Center for Disability Rights today to commemorate the 32nd anniversary of the Americans with Disabilities Act. Thank you to the Center for Disability Rights for their dedication to this work and their commitment to the members of our community.
Hello, I'm County Executive Adam Bello. 32 years ago, America made historic progress in the fight for civil rights with the passage of the Americans with Disabilities Act, a commitment to all those living with a disability that they would have equal access to jobs, schools, transportation, and public life. And I thank our hardworking community organizations like the Center for Disability Rights who fight to ensure everyone has full access to all the wonderful things our community offers. We know the fight isn't over. We must ensure the protections guaranteed by the ADA are followed, that the rights of everyone, regardless of where they live, their background, or their ability, are protected.
Inclusivity isn't always about people not wanting to be diversified. Sometimes we imagine that there are barriers to that happening, and we don't really know what's possible until we try.
32 years ago, on July 26, 1990, our nation moved ever closer to the fulfillment of its fundamental promise when Congress passed the Americans with Disabilities Act. The ADA affirms and protects the fundamental right of people with disabilities with the right to equal opportunity, economic self-sufficiency, independent living, and equitable participation in every aspect of American life. Since CDR's inception, we have been working to fulfill the promise of the ADA by promoting the full integration and participation of disabled people in our community.
So when Ann Caplow and I founded the organization in 1990, we bought a Voice TTY answering machine that was in my back bedroom. We were a volunteer group for 8 years. And then in 1998, we got a budget of about $300,000, and we thought, we were in the money. And we serve over 10,000 people across the state of New York. It's really amazing the impact that the organization has had. When I was asked, well, how big will it be? I thought, well, maybe it'll just be a few folks. Maybe 25 people would get their attendance services through us. Maybe we would help a dozen elderly women and stay in their own home. And for me, that was enough because that was a good deed. It was something to help people.
When someone's power chair breaks down, sometimes it takes the vendors a month or two to do repairs on it. We've accumulated enough power chairs and scooters to be able to assist them bring a power chair to their home, take their power chair, have it looked at, and if repairs needed, depending on the cost, we'll take care of it and bring their chair back so it doesn't stop anything. We're quite busy, but it's a good busy.
Back when the COVID first became an issue and vaccines were mandatory and apparently very helpful, it was CDR that was able to partner with Monroe County Department of Health and other community nursing agencies that allowed me and other people with disabilities to get vaccinated. CDR and RCIL have been instrumental from the outbreak of this pandemic, and I know they'll continue to be a valuable resource for people like myself in the community.
At the outset of the pandemic, CDR quickly pivoted to be able to support people with disabilities and elderly New Yorkers. We didn't know what was going on, but we knew that this was a highly contagious virus that was going to spread rapidly. And so CDR initiated wellness calls. We called over 10,000 people across New York State who we serve to check in on them and provide that peer support. That was literally an essential lifeline for some of the most isolated and disconnected people from our community.
Folks with disabilities had difficulty getting access to the vaccine early on. The vaccination site wasn't on a bus route, so you had difficulty physically getting there, and then once they got there, there were often barriers that folks had. To address that, and to make it more convenient for folks in the Northwest Quadrant and Center City of Rochester, we turned our office into a vaccination site. And we had folks coming in to get vaccinated. We were very proud of that work because we had people who otherwise might have waited or might not have been able to get vaccinated, be able to just come into the office and get the vaccine. And we saw getting shots in people's arms as a big part of our work within the disability community and within communities of color. We had, because of where we're located, we had a lot of folks getting vaccinated who weren't going out to the state vaccination site out in Henrietta.
The pandemic shined light on numerous inequities experienced by the disabled and those with intersecting marginalized identities. This includes wealth inequality, unstable housing, higher incarceration, higher institutionalization rates, subminimum wage, limited upward mobility, and the list goes on. The Center for Disability Rights fights day in and day out to make sure that disabled people and those living with chronic illness and/or in institutional settings are able to participate fully, are able to access the services they need, and then the feedback from what they say is actually listened to and turned into real concrete steps to affect positive systems change. The allocation of vaccine to CDR and the community partnership it has inspired is a replicable public health model communities can use to promote fair and equitable vaccine access to a population that cannot be served by the primary vaccine distribution system.
I'm so proud of my staff. They stepped up, they did the work, and then we did a lot of work to protect them and the folks who were coming in. So we put more money into the facility to make the air better, plexiglass shields, PPE to make people safe.
From the beginning of the COVID-19 pandemic, we knew access to information was vital to keep people safe. Every COVID briefing had an ASL interpreter to ensure the deaf and hard of hearing community was informed about COVID-19 testing and vaccination. We created an innovative partnership with the Center for Disability Rights to connect elderly and disabled residents to their nearest mass vaccination site in a safe, accessible manner. We saw results with more than 70% of our population fully vaccinated. This not only ensured equity, but it saved lives.
Donate to CDR and help us fight for disabled people's freedom.
If you would like to help support the Center for Disability Rights and people in our community, please donate.
Flip is 36 years old. He has cerebral palsy and he uses a power wheelchair to get around and a Dynavox communication device with a head stick or a hands-free mouse controller. CDR has worked with Flip since 2013 to help ensure that he can leave Monroe Community Hospital and live independently in the community. We have been faced by a variety of barriers that we had to overcome. No other organization is equipped to provide this kind of intensive and extensive advocacy and support.
My name is Flip Polizzi. I have cerebral palsy and need assistance with most tasks because I do not have use of my hands or feet.
For you, aids are really important because without them, you can't get out of bed, you can't get dressed, you can't eat, you can't take your medicine. But once you're in your chair, would you say you're more independent? So it's getting you to the chair and making sure you have your needs met. So without aids, could you live here? No. Why don't you tell us how you ended up in a nursing home? Because I don't think many people understand how a young person could end up in a nursing home.
People wonder how I ended up in a nursing home. It's crazy, right? I was in my 20s when I landed in long-term care. Never expected to live in a place like that. It never felt like home. But I didn't have family who could care for me. So that's what happened, and it took me 15 years to get out. I moved out of the nursing home 3 months ago and have struggled to find caregivers. There are a few reasons why this is happening. I think paying people $13 something an hour is a big problem. Even the best, most kind people in the world need a livable wage. When you pay people practically nothing, they aren't as motivated to show up or do what is needed. I also want to talk about people who don't have a family they are moving in with or forgotten by the current system. When I moved out of MCH and found a home, I thought I would be set because I have services through OPWDD. You'd think that would give me lots of safeguards, that I would be even more protected than the general population. But that isn't the case for people like me. OPWDD needs to update how they do things because they make it so hard to move out on your own. It's like they don't want you to do it. Your money takes forever to come in. You can't have furniture. Everything has so many steps and there are nice people who try to help. But the system is broken. And it makes it really hard to be successful. No matter how hard you try.
So lots of people end up with a guardian if they're in Flip's position. But the cool thing for him was he organized to sit in front of a judge, and he was able to speak on his behalf and show the judge that he could be his own guardian. And that was really his first step to getting out of the nursing home and getting his own place. If you don't have these agencies and these supports coming in, you have to advocate for yourself, but you have to have people who know the system. We need the funding so those kind of programs can exist. Without that funding and those supports, we won't be able to do it.
Imagine being a young person living in a nursing home. It's not easy. It breaks your spirit. I don't want to go back. I shouldn't have to.
No, and nobody wants you to. What do you think is the reason that you'd have to go back? What would send you back to the nursing home?
I wish that I could offer my caregivers more. I try to do my best to show them they are valued. But their job is hard and they deserve more. It's scary because if we can't figure this out, I will lose everything. I worked 15 years to get out the nursing home. Found this beautiful home. It's modified for me. And I don't want to lose it. I am trying to be hopeful. But the world is crazy and reliable workers are hard to find, and I worry every day that I won't be able to stay here. My heart will break if I lose all of this because lawmakers aren't protecting people like me. I am part of one of the largest minority groups in America. There are over 6 million adults with disabilities and many of us could live in the community if we had the right supports. It'd cost the taxpayers less to support us in homes instead of sticking us in long-term care facilities. Please help me spread awareness about this and help me stay in my home.
Oh. What do you love about this neighborhood?
My neighbors are great. I love where I live. There are so many places nearby. If I can't get to places in my wheelchair, I have to set up transportation. But it's working. I'd love to get a van someday too. I have big dreams.
I met Flip a while ago, probably 10 years ago, when he was trying to get out of the nursing home. I work as a transition specialist at the Center for Disability Rights, and we worked with a big team of people to ultimately get Flip his own place. We worked with Disability Rights New York to work on his guardianship. Now he's his own guardian. He's able to make his own decisions. This has been a very long road. With the help of the Center for Disability Rights and the Independent Living Center and all the other services that we put in place, Flip is successfully in his own place for the first time. He's been living here for about 3 months now. And the biggest hurdle that we still have is to find caregivers that are consistent, that will allow him to stay in his house. I loved working with Flip, and I would work with anybody else who wants the service.
Olmsted Housing is a program that we use to assist clients get out of nursing facilities and house them in the community. Similar to like a Section 8 mainstream housing voucher. We pay for ongoing rental assistance, or we can do one-time assist for clients to help them find housing in the community. And we set them up with resources like household goods, furniture, so that they can be successful. Rapid Transition is a very similar program to what I just described in Olmsted. We also pay a voucher to the landlord directly. You cannot have one-time assistance. However, we do provide the household goods, the furniture for clients, and they can live in the community on their own. This program is more geared towards people with disabilities who are homeless and unstably housed. Rapid Transition has a follow-up staff, which is an independent living specialist. They work with clients in regards to obtaining goals and reaching them. It's like a follow-up service that allows them to have somebody who they can rely on to link them into different services in the community, which allow them to be more successful. Speaking directly to landlords, this is a great program in regards to the fact that we pay ongoing rental assistance, and it's guaranteed. We don't miss payments. All throughout this pandemic, we haven't missed one payment. I know that's been a huge hardship for landlords. We also have a housing specialist that's like a intermediary between the client as well as the landlord, so that we can provide them with mediation and supports throughout the process. Housing rates have skyrocketed in regards to finding housing that's actually affordable in the community, so being able to subsidize rent for clients is instrumental. The population we're looking to serve is people who are disabled, and I actually need more accessible and affordable housing.
Hi, this is Dan Mason, General Manager for your Rochester Red Wings. Last year, we were fortunate to work with our friends at CDR in putting on their Trunk or Treat event here at Frontier Field in our VIP lot and also in the front of the ballpark here. They were looking for a safe, controlled environment, a large space, outdoor space, where they could have their families come and participate in some Halloween activities. So it was great to work with them and to create some awareness for their mission and welcome their families here from the disability community and allow them to participate in some great Halloween activities.
My name is Carla Style-Huffman, and I'm the Coordinator of Professional Development and Out-of-School Time Program Quality for GRASA, the Greater Rochester After School and Summer Alliance. Center for Disability Rights takes their advocacy work very seriously, and so does GRASA, because we know that when we're talking about the laws, regulations, rules, and programs that exist for our children and families, we want to make sure that they have positive impacts. And we want to reduce the number of hoops people have to go through to get what they need. So advocacy was a place where I saw perfect alignment between us. And that made it possible for me to want to advocate more for our out-of-school time programs to become more inclusive. Inclusivity isn't always about people not wanting to be diversified. Sometimes we imagine there are barriers to that happening, And we don't really know what's possible until we try. I was very excited when the committee decided that we could do an event and that GRASA could bridge the out-of-school time programs in the community to that event. And that's how we landed on the Trunk or Treat at Frontier Field. It was a hit. And the families had a great time. I had out-of-school time programs volunteer to set up a trunk, and they got to talk to families firsthand. And I really feel like this was step one in breaking down some of those barriers and helping GRASA help our programs to become more inclusive. We've already started plans for this year's event, which is going to be bigger and better. And I just want to say thank you to the Center for Disability Rights, to the staff that I work with, for being so compassionate and so willing to take risks on behalf of your clients. And I just want to say thank you for the privilege of serving on your committees.
Our relationship with CDR started about 4 years ago, and we are proud to support an agency whose work and mission aligns with our own personal beliefs, and that people with disabilities deserve the right to function in society without barriers. CEH Insurance is an inclusive agency with extensive experience in providing access for our employees and clients. We are grateful for our relationship with CDR and look forward to providing our services to them for years to come. The philosophy that we hold dear and true in your corner has no limits when it comes to servicing and supporting relationships such as the one we have with CDR.
I appreciate everyone who has stood with CDR and RCIL over the years, and I want to really encourage anyone else who is considering or who's asked to partner up and however they can, whether that's financially or with their time, or maybe just making connections with other people who they know can partner with us. It really does help.
While the ADA has been phenomenal in promoting the independence and freedom of people with disabilities, we have yet to get to a point where people can choose where they want to live and receive services.
There's an issue where Black and brown people are institutionalized disproportionately.
The attendants have not gotten a pay raise, and it's real hardship. I'm really lucky to have the attendants I have, and I actually really feel bad for them that they do all that they do for me and they're not paid more. People used to be able to have money in their pocket for buying presents for their kids. Nowadays, because of the low wages they're getting, I know a lot of my employees, they have to start saving up early and they don't spend like they used to. When people are forced into institutions, people can die in them just through lack of options. And it's not just a catchphrase. People literally do die when options are taken away and they're forced into institutions.
I used to live in a nursing home myself, and I fought hard to get out. With the help of CDR, I was able to get out. In the nursing homes, there are all types of people. It's not just older adults, it's young babies and teenagers that live in nursing homes, and they want to get out and live in their own homes. I was able to go back as a peer mentor and help be a role model to people with disabilities, to show them that they could live independently in the community. And this was a job where I was getting paid.
We are currently working on a federal bill called the LaTanya Reeves Freedom Act. It is a federal legislation housed in our House of Representatives. The sponsors are Representative Yvette Clarke, Democrat from New York, and Representative Steve Cohen, Democrat from Tennessee. And in the Senate, we have a bill as well, and it is sponsored by Senator Michael Bennet, Democrat of Colorado. We want to thank our sponsors of this bill because it's courageous in these times to step forward and say that we are working for the bodily autonomy of disabled people. What the LaTanya Reeves Act does is actually codify and make real what the ADA and the Olmstead v. Lois Curtis Supreme Court case come to fruition. We have seen over the years that what is not happening, what is stated in that SCOTUS case is that those people who are institutionalized and do not want to be institutionalized have the civil and human right because of the ADA Title II to get out of those institutions. And states are not doing that across the country because they don't have the resources, they don't have this law that would help to move this forward. The LaTanya Reeves Act would establish a comprehensive state planning requirement for each state. It would prevent state governments and insurers for engaging in discriminatory entities and activities, which they are doing right now for people who receive community long-term services and supports, LTSS. It would identify and address all of the things and provisions that are needed for community-based LTSS. And it would accelerate the state compliance for the integration of the ADA, which is exactly what we need. We're here 32 years later, and we still are at the floor of the ADA. We need more.
Over the years, CDR has led many local, statewide, and national advocacy campaigns, including championing representation in state government by getting the legislature to pass and the governor to sign legislation creating the Office of the Chief Disability Officer. The Office of the Chief Disability Officer gives disabled people representation in state government. Prior to that, disabled people did not have an office that met the unique cross-systems needs of people with disabilities. Many times, people with disabilities receive services in one or two service systems. The Office of the Chief Disability Officer recognizes that there's a problem in terms of incorporating people's feedback and will work across systems to meet the unidentified needs of people with disabilities. So better coordinating services and ensuring nothing about us without us in state government.
Our region is known for our civil rights legacy, and this includes advocacy for persons with disabilities. In Monroe County, we are setting a standard that fully complies with the ADA. We stand with CDR to make our transportation and infrastructure projects universally accessible.
All of the people throughout this video have at least one thing in common. They all believe in our mission and are working with us to achieve it. We've been very active during the pandemic meeting consumers' needs, which has been highlighted in this film, but there is more work to be done. To be the most successful, we need the help of everyone. We need people to provide resources, provide time, share expertise, and donate funds so that we can continue to achieve our mission and vision of a society where people with disabilities live independently. If you are interested in working with us as we pursue our mission, please contact us. The information is on the screen. You can be an important part working with CDR, making it possible for people with disabilities to live independently in the community of their choice.